The following video is going to demonstrate how to perform the Apley Back Scratch Test. This test is a functional assessment designed to evaluate the shoulder range of motion and upper body flexibility. This video will explain and show what this test assesses, which muscles and movements are involved, and why it's an important tool for understanding mobility. This test primarily evaluates the flexibility and mobility of the shoulder joints, involving the rotator cuff muscles like the infraspinatus, the supraspinatus, and the subscapularis, the teres minor, which will work to facilitate the external and internal rotation of the shoulder. The deltoids and the latissimus dorsi assist with the overhead and behind the back movements, while the triceps, biceps brachii, and pectoralis major also play supportive roles. Tightness or restrictions in any of these muscles can significantly impact range of motion. For instance, a tight latissimus dorsi can limit overhead reach, and restricted rotator cuff muscles can obstruct smooth rotation. The primary shoulder movements that we will be performing in the test are external rotation and abduction, and internal rotation and abduction. We will begin the test by positioning the participant in anatomical position, standing upright, arms at the sides, and palms facing forward. Ensure the participant's posture is neutral, with feet shoulder width apart and the spine in a neutral alignment. Instruct the participant to raise their dominant arm overhead and bend the elbow to reach down the spine as far as possible, ensuring the shoulder performs external rotation, abduction, and scapular upward rotation. We will instruct the participant to place the opposite arm behind the back, bending the elbow to reach up the spine as far as possible. The shoulder should perform internal rotation, adduction, and scapular retraction without excessive anterior shoulder tilt. The objective is for the fingertips of both hands to meet or overlap along the midline of the body, specifically around the thoracic spine. Ensure the participant maintains scapular stabilization and avoids compensatory movements, such as spinal lateral flexion or excessive rotation. There are two reach methods: fingertip touch method and the fist method. In this video, we will be demonstrating the fingertip reach method. For the fingertip reach method, measure by using a ruler or tape to measure and record the distance between the fingertips. Negative value would be if they do not touch, positive value if they overlap. If the hands fail to touch, measure the gap as a negative value. If they overlap, measure the amount of overlap as a positive value. Ensure the measurements are taken at the point of maximum reach, with the participant maintaining the position without compensatory movements like trunk rotation or scapular winging. Be precise with the measurements and record whether the test was performed on the dominant or non-dominant side. This allows for a comparison range of motion between the left and right shoulders, helping to identify any asymmetries. My client is left hand dominant, therefore some asymmetry between left and right will show. After measuring both sides, document the results for analysis. Consistent measurement techniques are essential for reliable and valid outcomes. And that's how you perform the Apley Back Scratch Test. Here are the results. The measurement of the right shoulder external rotation, left shoulder internal rotation was negative 22.86 centimeters. And the left shoulder external rotation and right shoulder internal rotation was measured at negative 29.21 centimeters. Because my client exceeded the 5 centimeter threshold, this shows some flexibility limitations, and here are some of those limitations observed during my assessment. The right shoulder, during the external rotation, is significantly away from the full range of motion, likely due to tight deltoids, latissimus dorsi, and shoulder capsule tightness. The left shoulder, during the internal rotation, shows winged scapula, also a gap between the bicep and the lats. Limited internal rotation due to light infraspinatus, teres minor, and posterior capsule. The right shoulder, during internal rotation, abducts into the frontal plane instead of a sagittal plane. This is due to tight deltoids and compensatory movements in the glenohumeral joint. Left shoulder, during external rotation, has limited range of motion. The humerus not perpendicular to the ground, elbow misaligned, and bicep distance from the ear. Could be limited to scapular upward rotation. Assessing this movement is important because shoulder mobility is essential for everyday tasks and athletic performance. Limited range of motion can affect activities like reaching overhead, throwing, swimming, and lifting weights. It can even impact posture and contribute to compensatory movements that lead to overuse injuries. By using the Apley Back Scratch Test, we can pinpoint which muscles might be tight or weak and identify any asymmetries between the left and right shoulders. This information helps create targeted corrective exercises to restore balance, prevent injuries, and optimize performance. Here are 5 corrective exercises to help with flexibility and mobility. Beginning with the scapular wall slides with overhead reach, targeting the upper trapezius, serratus anterior, rotator cuff, specifically the infraspinatus and the subscapularis, and the scapular stabilizers. This exercise improves the shoulder scapular humeral sequence, making the shoulder more mobile for both internal and external rotation, and reduces the shoulder impingement risk during overhead movement. Next, we have the dynamic lat stretch with overhead reach, targeting the latissimus dorsi, triceps, and shoulder capsule. This exercise helps loosen the lats and triceps, which are often involved in shoulder and lower back issues and can reduce the anterior pelvic tilt, while increasing shoulder mobility for both internal and external rotation. Another exercise is the dynamic shoulder internal and external rotator stretch with band, targeting the internal and external rotators of the shoulder, specifically the infraspinatus, teres minor, and the subscapularis, improves the ability to reach both behind the back and overhead by addressing tight internal and external rotators, improving both shoulder, internal and external rotation, and overall shoulder function. Another exercise is the cat-cow with lat stretch. The targeted muscles are the latissimus dorsi, erector spinae, thoracic spine, and the shoulder stabilizer. It enhances the shoulder overhead reach by releasing the tension in the latissimus dorsi and improving spinal mobility. This dynamic movement also prepares the body for full body workouts by increasing flexibility in the shoulders, back, and core. Last but not least is our side laying open books, targeting the thoracic spine rotators, pectoralis major, anterior deltoid, and obliques. This exercise enhances the ability to perform rotational movements and improves shoulder flexibility by addressing restrictions in the thoracic spine and anterior shoulder muscles. It also helps with counteract poor posture caused by the prolonged sitting or forward rounded shoulders, making it especially beneficial for athletes and desk workers as well. Thank you for watching.